Hello, I'm Matthew Weinstock with a preview of the February issue of Hospitals and Health Networks. The cover story takes a look at the staffing and resource challenges hospitals and health systems will face as they try to address population health. Here is Bill Santamore with a closer look.
February's cover story looks at the critical need for hospitals to step up their population health game, to position themselves for accountable care and bundled payments. A robust population health program requires a much more sophisticated level of data collection than most hospitals now have. But collecting the data isn't the real story. What's most important, and what is a huge challenge for most hospitals, is the ability to understand what the data can accurately and fully tell them about the health of their communities. Like, what diseases are prevalent and at what rates? How should they design or redesign their business strategies to meet the unique needs of their populations in order to improve care and to improve their own operational effectiveness and viability? But finding people who understand the clinical side of things and who have the analytical skills to make sense of the collected data isn't easy. They're very rare. Our cover story shows how certain hospitals are growing their own population health staff, either by identifying existing staff who have the clinical knowledge necessary and educating them on data analytics, or by hiring skilled analysts from outside of healthcare and teaching them the clinical component.
Thanks, Bill. In this month's issue, we also launch a bi-monthly series that'll analyze the dramatic impact diabetes is having on the nation's healthcare system. Nearly 26 million Americans have diabetes, and that could climb to half of all Americans by 2020. The disease is responsible for $116 billion annually in direct medical costs. Throughout this series, we'll look at how hospitals and health systems are trying to better manage their diabetes population. Finally, in our interview, former CMS Administrator Donald Berwick talks about his potential run for governor of Massachusetts and provides an assessment of the healthcare quality movement. For those articles and more, be sure to check out the February issue of H&HN. I'm Matthew Weinstock. Thanks for tuning in.